Hi everyone, welcome back to my YouTube channel. It's your girl Jane here, and this is Overseas Nursing Bands. Thank you for sticking on. Thank you everyone for subscribing. You've all been amazing, and I want to say thank you to my old subscribers. And if you're new here, welcome. We discuss everything UK nursing, everything healthcare related nursing, OSCE tips, and a bit of fun and inspiration, really. But before we go ahead, I just want to find out, how are you? Doing well? All right then. So, welcome back. Today, I can't remember the person's name now. Somebody asked me to do care plans. I have a Matrid. I believe it's a very straightforward way. You can use it to do any care plans, but I'm going to give more tips on how to make care plans in your planning section during your OSCE. We're going to do that today. So, before we start, I just wanted to say that we know that in the new test of competence, it is a slight change from the legacy OSCE. So in the new test of competence, there's no more self-care. There used to be self-care in the old one, and in the new test of competence, it's 14 minutes. And to be honest, I think this is easier, especially that self-care used to be like, what is this? But yeah, so you have no more self-care and you have 14 minutes, and it's a quiet station, so it's you and your pen that will be writing and no speaking to your by yourself anyway. So I'm going to just create a scenario. I'm going to give you points that you can use for any. If you add this up with your Emma treat, it's going to be straightforward. You just think of this points, you know that, and then you just add a few more points that you need. It's going to help you in your OSCE. All right. Again, I apologize because this person posted and said to make more care plans, and I've not been able to do this for such a long time. I'm so sorry, and I've not posted for, oh gosh, I need to be more consistent, but trust me, I'm trying my very best. I don't just want to bring you rubbish. So like I said, the new test of competence is 14 minutes, and there's no self-care as before. So you still have two nursing problems slash needs, your aim of care, reevaluation dates, and your nursing intervention. Okay, so I'm going to use scenario of, say, TJ. TJ is our patient, so TJ Hudson. We're going to be using him. So your scenario is TJ Hudson, a patient, a 40-year-old patient came into the ward with pneumonia, a diagnosis of pneumonia and shortness of breath. So we're going to work on that, and then you use the point. You can use it for every other thing, some generic points when you're doing your nursing intervention. All right. So we're saying, so he's experiencing, your nursing diagnosis is going to be, I'll use one for example, say experiencing shortness of breath due to pneumonia as evidenced by respiratory rate of 24 beats per minute, uh, 24 breaths per minute. Okay, so what is your aim of care? What are you aiming for this patient that came in, and what are you aiming to, for your care for them? What your aim for them? So you say to relieve shortness of breath by monitoring maintaining a respiratory rate of 12 to 20. Obviously, you know what the normal respiratory rate is, 12 to 20. So they are between 12 or 20. I know you're using your new score. Definitely, if you're having this, you're doing your new score. Somebody say amen. All right. So you're saying the aim of care, your nursing diagnosis is Mr. TJ is experiencing shortness of breath due to pneumonia as evidenced by respiratory rate of 24 breaths per minute. That's your nursing diagnosis. And your aim of care is to relieve this shortness of breath. So Mr. TJ will feel to relieve shortness of breath for Mr. TJ by maintaining a respiratory rate of 12 to 20 breaths per minute for the next 24 hours. Remember, you're smart when you're doing your nursing diagnosis, your nursing care plan. Smart, measurable, and all that. Remember that. So I want to make sure that, okay, within the next 20, you don't want to leave somebody gaps in like that for the next. That's not good. So you want to make sure bring a relief to them within the next 24 hours. If it's pain, obviously you don't want to leave somebody in pain for 12 hours or 24 hours. You want to say in the next 30 minutes this person must be pain, must be okay. Let's not go to pain, let's not confuse, let's just stick on respiratory, we're doing shortness of breath so that we don't get all jumbled up. But just make sure know that when you're doing your nursing diagnosis, you're going to be using your nursing diagnosis is going to be the things that are more important and needs urgent attention, you know. So if you have someone that is hasn't eaten and somebody that is bleeding, obviously somebody that is bleeding is going to take priority. As with somebody that is having this shortness of breath, now it's take because you want them to breathe properly, and we know what this can entail. So what is your evaluation? What when you evaluate this person, you don't want to leave them for long, so you will say 2 hourly for this one. Now if it's pain, depending on what is presenting. So Mr. TJ, you're going to reevaluate every 2 hourly or as soon as condition changes. I mean, you're gonna say, the person is going and you're saying, okay, I've said 2 hours. No, if you've just checked them 30 minutes ago, 20 minutes ago, and the changes, and the next thing they're going obviously you need to reevaluate. You need to have another nursing intervention to relieve that discomfort for them. But if nothing changes, 2 hourly, okay. So now your nursing intervention, this nursing, just take note of this nursing intervention. This is honestly the point. Usually you should give 6 to 10 points, 8 points, and this generic in points that you need for, you can use it for any nursing diagnosis, for any care plan, and then you add now specific. Okay, so if you can go and check that MH rate, it's really helpful. It's just the same, almost the same thing, but I'll just give you the 5 pointers that you can, when you have these 5 pointers, and then you now take, depending on what specific care plan you're doing, you can now add to that specific condition. Okay, so we're doing shortness of breath today. So I will say you will, in every of your care plan, you explain what you're doing and obtain consent. Tick. Correct. You monitor and record vital signs. So depending on what the situation, you cannot add it, but record, monitor vital signs. Tick. You make sure that the patient has call bell with them, so if they need to get to you, they can come, they can call your attention quickly. Tick. This is generic. You use it for every of your nursing care plan, for every of your nursing intervention. You have to use it. Okay, and then probably administer prescribed medication and monitor effects. Okay, so for every care plan you're doing, if they have been prescribed any medication for that condition, you have to administer prescribed medication and monitor effects. Tick. So how many have we talked about? That's 4. And then you have to document every care given. You do it for all your care plans. Every care given, you have to document. This is like the holy grail of your care. When you're in practice, if it is not written down, you have not done it. There's no, but I did it. Where is it written down? So document all care that you have given. Sorry. Then you can now come to condition specific. So we're dealing with shortness of breath. You can now add 3 things to that to the condition. So if you were dealing with preparative, you're dealing with pain, you're dealing with anxiety, you're dealing with malnutrition, you can now add 3 or 4 more things in relation to that condition. But if you do these 5, that's your 5 points already. Okay, and then you now add 5 more not 5 more, sorry, I beg your pardon. You now add 3 to 4 more. If you have 5, if you have the time, why not? So for this, we're doing shortness of breath. So I would say assess breathing pattern for depth. I will assess the breathing pattern for this too, for depth, so that you know, okay, is it going normal now? Is it still shallow? Is still assess breathing pattern for depth. You refer to a multidisciplinary team. So depending, you can refer to which people now do you refer for, that have breathing condition. So you can refer to any of the multidisciplinary team in. So if you're having pain management team, if you're having whatever the condition is, just refer. They have to refer if smoking cessation, whatever. So refer to the multidisciplinary team, the MDT, for that condition. And then for specific, in this case now, this person is having shortness of breath. So you nurse in an upright position, at least to receive relieve the pressure on the intercostal muscles, on the diaphragms, and all that is what you do. And also you health educate. Actually, health education goes for all of the conditions as well. You health educate them on if they were smoking, how it's affecting them, if they had pneumonia, on personal hygiene, on diet, on nutrition, on diversional therapy, depending on what the condition is. So it's very straightforward. You can use it for any nursing care plan, especially, and with this new test of competency, it's brilliant. So yeah, I hope this is not too jumbled and it's a bit clear, but I was just trying to make it how it will be easy for you when you have this point. Okay, you have this 5 points. It's just to look for 3 more points to help with your nursing intervention, and that is it. And there's no self-care, and you're doing well, and I just hear about your past. That's it. Okay. All right then. So thank you so very much for watching. I hope this helps, and please don't forget to send me a message to tell me about your passes. Congratulations in advance. Bye. God bless you.